Tubal reversal surgery at our center is very safe. Anyone attempting to be a patient at our center must complete an online scheduling questionnaire and a phone interview with a member of our nursing staff. Our questionnaire and phone interview are designed to screen out any patients who may be at higher risk for surgery and who may not be good candidates for surgery in our center. Surgical safety is our highest priority. A very important of our surgical safety policy is our body mass index, or BMI policy. We will not operate on any woman who is over the maximal BMI limit of 37 or any man who is over the maximal BMI limit of 45. Over a 5-year period, we performed approximately 3,000 surgeries and we had 0 operative complications, which required a patient be transferred to the hospital. Let me state this another way. Over a 5-year period of performing surgery in our center, we have never had to send a patient directly to the hospital from our operating room. Bleeding is a risk with any surgery, and heavy bleeding during surgery is a risk of tubal reversal. The risk of bleeding are increased with increasing body mass index and with surgeries that can cause a lot of scar tissue, like a history of multiple C-sections or uterine fibroid removal. Although bleeding is a risk of surgery, we rarely have bleeding complications, and we have never had to transfuse a patient during or after surgery because of bleeding. Any surgical procedure that involves making an incision on the skin can increase the risk of infection. To minimize the risk of infection, we have a maximal BMI limit for patients. We provide an antibiotic in the IV during surgery. We do not routinely insert catheters into the bladder. We practice meticulous surgical technique with a very skilled staff, and we ask patients to use Hibiclin surgical soap before and after surgery. We perform approximately 600 surgeries a year, and we may have 2 or 3 patients a year with minor infections of the skin. The main risk of reversal surgery is that the surgery will work and you will actually become pregnant. Many patients laugh when I tell them this, but I'm really being serious. The main risk of tubal reversal surgery is getting pregnant in your fallopian tubes. This is called ectopic pregnancy. The chance of ectopic pregnancy is 10%, maybe 15% after tubal reversal. An ectopic pregnancy that is diagnosed early can easily be treated with medication. If an ectopic pregnancy is allowed to grow too large, then surgery will be required to remove the pregnancy. This could result in damage to the fallopian tube, or your doctor may have to completely remove the fallopian tube. When our patients become pregnant, we recommend they see their local doctors as soon as they have a positive pregnancy test so their doctors can check their pregnancy hormone levels. This is called the HCG blood test. Using the HCG blood test and early ultrasound, your doctor can detect early ectopic pregnancies and can treat these pregnancies with a medication called methotrexate. We estimate that 10% of women who have tubal reversal may have their tubes gradually heal closed from scar tissue. In medicine, we cannot predict or control how any individual heals. Some people have surgery and you can barely see their incisions. Some people you can see their incisions from across the room. Some people get piercings and don't have problems. Some people get piercings and develop keloid skin tumors. Everyone heals differently. Healing can be impaired in patients who smoke cigarettes, those who get infections, or who have poorly controlled diabetes. We recommend patients try to be as healthy as possible after surgery, take a vitamin, stop smoking, and if they are diabetic, keep their blood sugars under good control. The vast majority of our patients will have a successful pregnancy. Most patients, but not all, will become pregnant. A few will have tubal pregnancies, but many of our patients will have healthy and successful pregnancies after their tubal reversal surgery.